Should you use ice as a treatment for your tennis elbow? In a word, no. Ice is nice in your drink, but not on your elbow. Yes, I know what you're thinking, but what about the inflammation? All the medical websites and authorities say I should ice my tennis elbow to reduce inflammation. Could they all be wrong? Well, if you'll just give me a couple of minutes and keep an open mind, I'll explain why they are mistaken, why inflammation is not the real problem with tennis elbow, and why icing probably won't help you one bit. This is Alan Willett from Tennis Elbow Classroom with another tennis elbow tutorial. And here's the short answer for you. The truth is, inflammation is actually part of your healing process. And most of the time, when it comes to tennis elbow and many other tendon problems, there's no real benefit to icing it or trying to chase it away with anti-inflammatories. Were you aware of this fact? I'm really curious. Please leave me a comment below and let me know, because I rarely see this simple fact mentioned anywhere, which is why I also made a video about it called Inflammascam Exposed. I think it's still one of those insider secrets the medical pharmaceutical complex would rather you didn't know. They can sell you more drugs that way. I also think learning this simple fact is a big step toward understanding how to help tennis elbow heal rather than fighting it. So what happens anytime you injure something is that the healing process kicks in, and inflammation, that's the first step in that process. Now sometimes when you have what they call an acute injury, you do get a lot of swelling, and in that case there is some benefit to using ice right after the injury to reduce the swelling. Now let's break that down. An acute injury is usually a more sudden traumatic kind of injury, often involving some bruising or tearing, like a sprain or a strain. Yeah, sometimes tennis elbow starts out this way, but most of the time tennis elbow creeps up on us. It's usually a sneaky, gradual breakdown. Now for a good example of an acute injury, let's take an ankle sprain. Have you ever sprained your ankle really badly or seen someone who has? You're almost certain to see some swelling from the inflammation, and there's no debate that putting some ice on that is the right thing to do at first. Let me repeat that swelling is the bad thing here. I mean, it means that there's too much fluid building up in the area. And you can tell because it puffs up visibly, and it also feels kind of spongy when you press on the area. And that's not a good situation, because it means the area has gotten all clogged and congested, and your circulation is slowed way down. It's bad because you need good circulation for healing. Swelling is not the feeling of tenderness, soreness, pain, or the presence of redness you can see on your skin, although these symptoms often do go along with it. Swelling is really only the buildup of fluid. So my question for you is, can you see any swelling around your elbow? Does it feel significantly puffy to your touch in that area? Now I'm not trying to diagnose you here, but if you don't see it, there's probably no significant swelling you need to be worried about. And icing, it won't do a thing for you except make your pain feel a little better for a while. Of course that's better than popping anti-inflammatories, but the bottom line is it won't help you heal any faster. If you do a lot of icing, it may actually slow your healing down. As a side note, I've been treating tennis elbow cases frequently for at least 7 years in my practice, and I can't remember ever seeing one person who had any significant swelling around their elbow. Okay, let's quickly sum it up now. Inflammation is the first step in your healing process, and you can't have any healing and repair if it doesn't happen. If there's raging inflammation that's causing a lot of actual visible swelling, then icing it down a bit to reduce the swelling is helpful. But this is usually only right after an acute traumatic injury, and typically not in most cases of tennis elbow. If there's no swelling, only redness, pain, tenderness, and similar symptoms, then you could use ice to make it feel better, but if you overdo it, you may unintentionally slow your healing process down. And if you unfortunately succeed in stopping all inflammation with ice and anti-inflammatories and cortisone shots, then you've basically stopped your healing process. They never tell you that, do they? That's why, in my opinion, I think it's best not to ice at all unless there's obvious swelling. And this is only the beginning of what I have to share with you. If you're tired of chasing your tennis elbow symptoms around in a vicious circle, following the latest remedy, trick, or cure, let me give you the big picture view of tennis elbow and how your healing process really works, so you'll know what to do to help it heal instead. I've got more free articles, videos, and a 47-page ebook, Escaping the Tennis Elbow Triple Trap, you can download for free at tenniselbowclassroom.com. Best of all, premium members get instant access to the full self-help video program I developed for my tennis elbow clients. where I'll guide you through a simple, easy-to-follow strategy of therapies, stretches, and exercises designed to break your vicious tennis elbow cycle and heal it 100%. Just click the link below to tenniselbowclassroom.com and get your free ebook and more helpful free tutorial videos. But before you go, please take just a second and rate this video. Give me a thumbs up by clicking the like button below if you've enjoyed watching this on YouTube or a similar site. And please throw me a question or comment below. What do you think now about icing as a treatment for tennis elbow?